More than 75 nursing home workers shook hands with their employer on a new 17-month contract at Kenmore's Schofield residence. Now, healthcare workers will be heading to Albany this coming week to fight for better pay and conditions in the state budget.
Right now, we're joined by Grace Bogdanov, the 1199 SEIU Vice President for Western New York Nursing Homes. Grace, thank you so much for being here this afternoon.
Thanks for having me.
So before we talk about this new contract, let's walk back to November. For those who may not know, what were you guys fighting for?
Really just increased wages and improved benefits in the contract, along with a few other small items. But Schofield relies heavily on agency workers, contracted temporary workers, and has really struggled to recruit and retain a dedicated workforce. So trying to bring up those wages to meet area standards was really important and top of mind, as well as protecting the hard-earned benefits that our members have.
So let's talk a little bit about what was gained in this 17-month deal. What were some of the benefits that you think your members are going to be really happy about?
Yeah, absolutely. Top of mind is the pension. We were able to improve the pension contribution by the employer and to maintain the pension, which is very important for our members. Also improving starting wage rates for new hires so that we're able to be a little bit more competitive in the area across all job titles, including a pay scale for experience so that folks with experience are able to come to Schofield and become, full-time or part-time employees.
Now, we were talking in the break about the duration of this contract. You said previous contracts were 3 years of length, or 3 years of duration. This one is 17 months. Can you talk a little bit about why that was decided?
Yeah, absolutely. Schofield is one of the employers that actually for us in the past has helped to set wage and benefit standards in our area. And we then will call on other nursing home employers to do the same, to do the right thing. But Schofield isn't unique in this case where we were up against a funding issue. Schofield is underfunded, and this is not unique for Schofield. Nursing homes across the state, particularly in Western New York and in upstate New York, are funded at a rate that does not cover the actual cost of care. So across New York State, Medicaid funding only covers 76% of the cost of care. And when we talked with Schofield about what a realistic contract looked like, there's a lot of uncertainty. And because of that, we settled on a 17-month contract to give us some time to go to Albany and to do the work that we need to do, calling on our elected officials to properly fund Medicaid across the state.
Before you mentioned agency staff, who does this contract cover in terms of, why it's so important to have a long-term staff, dedicated staff members?
Absolutely. So we represent at Schofield across all job titles. So housekeeping, dietary, certified nurses assistants, and licensed practical nurses. The therapy department as well. What's really important is a consistent bedside caregiver. So for a resident to see a strange face every single day makes a difference in the quality of care that they receive. So when you have a dedicated and consistent workforce, when you eliminate agency use and you're able to offer quality jobs, full-time jobs for folks that come with quality benefits, then these residents are getting the attention and the care that they really deserve.
That's very true. When it comes to what your fight in Albany is, I think you've already kind of explained that. I guess my question is, with the State of the State happening on Tuesday, that's why you're all heading up, what's the best way to go about affecting change? Because as you mentioned, it's not just here, it is across this entire state.
Yeah, I think our elected officials need to hear us loud and clear. So we are sending healthcare workers from across the state to Albany on Monday, ahead of Governor Hochul's State of the State address, to talk about what it's like in a nursing home or in a hospital, where every single day healthcare workers are burning out. They're struggling to provide the care that their residents actually need and deserve. And ultimately, elected officials have the power and the ability to fund Medicaid and to help us reach Medicaid equity across the state. And so that's what they need to do.
And not just at Schofield, is there anything else you guys would like to see in the field, change-wise?
I think, in long-term care, there's the biggest problem right now is the crisis of lack of funding. So we need to fix the funding issue first and foremost. And then there's accountability, and there's, career ladder and a pipeline for healthcare workers to go from maybe being a certified nurse's assistant to a licensed practical nurse and on with their careers. So there's so much work to be done, but the real crisis at hand is Medicaid funding.
Grace, that is all the time we had for this interview today, but we do wish you luck in your quest to improve conditions, not only here in Western New York for people who are living in our nursing homes, but also across the state. Thank you for being here.
Thank you so much.